Good afternoon. My name is Latasha, and I will be your conference operator. At this time, I would like to welcome everyone to the Driver Wellness for Commercial Fleets conference call. All lines will be on mute to prevent any background noise. We will have an interactive question-and-answer session later during the call. If you would like to ask a question during that time, please press star 1 on your telephone keypad. You will hear a tone acknowledging your request and a prompt to record your name. Thank you. Ms. Kathleen O'Shaughnessy, you may begin.
Hello and welcome to Driver Wellness, which we're presenting today. Our presenter is Steve Bojan from Hub International Limited. Before we begin, I want to let you know that this presentation is being recorded and will be posted to our website at www.hubinternational.com on our risk services page. Also wanted to let you know that the slides will be posted there as well. Our presenter today is Steve Bojan. He is our VP of Fleet Risk Services in our Risk Services Division. Steve Bojan brings 17 years of operations and risk management experience in the transportation industry to Hub. He came on board as a senior risk consultant and today serves as a resource for transportation-related risks, providing risk control, safety, property, environmental, and workers' compensation reduction guidance to Hub clients. His specialties include but are not limited to transportation risk management, driver and supervisor training, truckload operations, DOT compliance, safety program development, and specialty fleet operations, including moving and non-emergency medical transportation. So without further ado, we're going to move to the focus of today, which is driver wellness. Steve.
Thank you, Kathleen, and I'd like to welcome everybody to this presentation. We're talking about driver wellness because it's really coming to the forefront in the last couple of years. In our presentation today, we'll talk about what some of the major issues are with wellness. We'll talk about some typical driver health issues. What are some of the common but yet critical illnesses? Personal solutions for drivers, what they should be doing on their own. Also some company solutions. How can we encourage and coach our drivers to do better? And then we'll finish off with the question and answer session. Let's start with what is wellness. Go with a pretty basic definition. It's an interactive process of becoming aware of and practicing healthy choices to create a more successful and balanced lifestyle. It's really important to realize that to do this, one, we need to realize that what it feels like to be healthy, because some people just don't understand that, and two, that really to be successful in life, as is often said, if you don't have your health, you don't have anything. So we talk about driver wellness for employers. There's a number of reasons why it's really important. There's compliance and licensing concerns. Obviously, on the driver qualification side, our drivers need to meet certain minimums or maximums, depending on how you look at it, in terms of benchmarks for health, in terms of blood pressure, blood glucose, insulin dependence, having all your digits, things like that. Also on entry-level driver qualifications. Now, if you have drivers who have less than a year of experience with the CDL, we need to be educating them on driver wellness. There's no specific as to what we need to talk to them about, but we do need to talk to them about wellness-related issues. Additionally, starting in 2014, all medical examiners are going to need to be certified as part of the MAP 21 program. For most of our drivers, if you have CDLs, in the last 2 years they've been receiving letters or notifications from the various states to bring in a medical card so that it can be tied to their license. Starting in really the regulation at this point is you need to qualify for a new CDL, you need to have a valid medical card. And starting next year, the medical card is supposed to be tied to the CDL. So in theory, if you have a CDL, you won't need to have your medical card. I wouldn't, at the rate government goes with all this technology, I wouldn't hold my breath, but the plan is right now for May of 2014. So the underlying issue here is as much as the medical card and the CDL, having a CDL were tied in the past, now they're going to be intricately put together. And this is already, for people who live in Indiana and a couple of other states, they've already experienced this, where a driver who is disabled or goes out for a while, they're not able to, their CDL is disqualified until they're able to show a valid medical card. One other thing is DOT physicals, as part of the examiner certification, DOT physicals are going to become much more standardized, and expectations for medical providers are going to be raised considerably in the next year or two. Again, for drivers, why wellness? Talk about driver disqualification. There's a driver shortage out there, and we don't want to have our drivers disqualified. And there are a number of illnesses that will automatically disqualify a driver if untreated or if they can't meet certain thresholds. Those include insulin-dependent diabetes, blood pressure over 160, obstructed sleep apnea if not treated, also some forms of heart disease, and others where the driver is physically or mentally impacted. There's also aging workforce issues. The commercial driving force is getting considerably older. Young people aren't becoming drivers. Older displaced workers are entering the driver workforce. And just in general, truck drivers are staying in the business longer than they used to, meaning the average age of a commercial driver is now over 50. Another concern for employers is productivity. If drivers aren't feeling well, they can't do their jobs as effectively. They take more rest breaks. They can't exert themselves physically to do the job that's required. And they tend to, when you're not well, you tend to work shorter days, and you can't go on those long runs that maybe you used to send the driver on in the past. Additionally, crash avoidance is a huge issue. There have been a number of critical crashes involving driver health issues. One in particular in southern Illinois earlier this year, where the driver blacked out and struck an Illinois state trooper, killed a trooper, was in the national media for a number of weeks, as that driver didn't have a valid medical card, and it was very unfortunate, and it put the company in a very bad light. Another issue is insurance costs for both your liability and your workers' compensation. Reducing work, a key component of driver wellness is reducing work-related injuries. Healthier drivers get hurt less. Employee morale is a huge issue. If healthy employees are happier, they tend to be willing to work more, and they just get their job done in a more efficient manner. And lastly, public relations. It speaks to the company's and industry's commitment to safety when we embrace wellness. A number of very large trucking fleets have started to publicize their wellness programs as a way to, one, show the public how concerned they are about safety in their employees, and two, to attract new employees. Many employees, their families are concerned for them and are pushing them to companies where they have these wellness programs. For employees, why is wellness so important? First and foremost, it allows them to continue as a driver. A lot of drivers don't understand what the disqualifications are, and that it'll prevent them from what is now a good-paying job. There's another plus for employees is if you stay well, there's no need for additional oversight. At certain thresholds, a driver right now needs to get his medical card renewed more often than the standard 2 years. As blood pressure raises and other medical issues become prevalent, the occupational medical provider will require that medical cards be renewed at 1 year, 6 months, even 3 months, these increased intervals to make sure that physical maladies are being controlled. Enjoyment of pastimes, including family and friends, is a huge part of wellness. One of the things that's often discussed during driver wellness meetings is the ability to put a grandchild on your lap. When you're not taking care of yourself, it becomes very challenging. Financial savings are also huge. The cost of being ill is massive, and even if there's a good health insurance program at the driver's employer, the cost can still be huge. And last but not least is happiness. If we feel bad, we're just not going to be very happy, and it takes over our whole being. Additionally, wellness applies to mental illness. Many drivers struggle as they are alone for long periods of time or do not do well with other people. A big part of wellness is finding that, I guess, that happy place, as we call it. Big challenge on finding a happy place are the demands on truck drivers. There are the physical demands, getting in and out of the truck multiple times a day, moving freight if you're required to move it by hand if it's not no-touch, maintaining the vehicle, doing inspections, pulling the hood, sliding tandems. These are huge physical exertions on drivers, and they often have to be done in not the best of outside conditions. Time demands. Drivers work at odd hours. We're going to talk about this a little further. And they can have to work from 14 to 16 hours a day. Psychological demands. There's no let up behind the wheel. When you're driving, you can't just stop for 5 minutes. It's almost like being on a production line. You have to be alert, especially when you're driving a large, heavy vehicle. And there's other drivers on the road that just plain aren't cooperative or are rude, and that can be very stressful. There's restrictions on lifestyle choices. Drivers may not get home regularly. It's difficult to find places to eat that will accommodate a semi or another large truck. And also, where and when can they exercise? If you're driving 14 to 16 hours a day, if you're on duty 14 to 16 hours, driving you're 11, it's hard to find time and often hard to find a place to exercise. Fatigue issues are huge, especially for over-the-road drivers that are out on open highway where complacency and tiredness comes from just sheer boredom. Heat can be an issue depending on where you're driving. In heat, we tend to get more fatigued. And also, another big issue with fatigue is circadian rhythms. We tend to get tired from 2 to 5 p.m. and from 1 to 5 a.m. Our body is naturally tired due to the time of day. There's also hygiene concerns for the driver. These are some demands. Truck stops are often not the cleanest place to go. And if they're living in a sleeper berth, it's not very large and doesn't allow for, you're forced to literally live for 4 or 5 days in an incredibly small space, which leads to oftentimes a somewhat dirty environment. And lastly, we have operational restrictions that place huge demands on drivers. These can include demanding dispatchers and demanding customers that say if you're not here within X amount of time, you're going to have to wait and go to the back of the line to be unloaded, or you need to unload this right now because we don't have anybody to do the work for you. Now let's focus a little bit on truck driver health issues. Some general health issues for drivers include work-related injuries. These can include sprains and strains, falling in and out of the truck, lifting heavy items, poor or inadequate sleep. Again, going to that, it's difficult to sleep in a truck, and if you're working to 14 or 16-hour days, it's hard to get in that rhythm of sleeping, especially when you're out over the road. Obesity is a huge problem for truck drivers. It's thought that 90% of commercial motor vehicle drivers are overweight and 70% are obese. That's probably 20 to 50% higher than the general public. And obesity is a significant factor in many driver medical issues, as we are about to discuss. Lastly, I think one of the other big general health issues is hypertension and high blood pressure. Again, due to the stress of the job, poor eating habits, and also obesity. Now let's talk about some specific health issues. Diabetes. We'll talk about that a little further, but it's a huge issue among truck drivers. Heart disease, sleep apnea, cancer, dental and oral health. Where are drivers going to go and brush their teeth or make sure that they eat the right foods and avoid sugar? leg and foot wounds, huge with diabetes, and just a big problem with drivers scratching, walking in areas where there's nails and not good and not well-kept grounds. Mental health is a big issue. And last but not least is substance abuse. Although there is random drug testing for all commercial drivers over 26,000 pounds, it's not uncommon for drivers to have issues with drugs and alcohol. Start by talking about hypertension and high blood pressure. High blood pressure may affect up to 40% of commercial drivers, as was noted in a recent study. That's about twice as much as the general population. While blood pressure restrictions are part of the medical examination long form, but a lot of drivers don't realize what the limits are and walk in and don't have controls in place. Unfortunately, uncontrolled hypertension can lead to other problems, such as heart attack, stroke, and kidney failure. These will disqualify a driver and may end his life. On the plus side, hypertension, high blood pressure is relatively easy to control with diet, exercise, medication, and stress reduction. And as we go forward and talk about driver-related solutions, we'll come up with some suggestions to help your drivers. Sleep apnea. Obstructive sleep apnea really means that the tongue and tissue relax during sleep, blocking the airways. The brain identifies the need for more oxygen and briefly awakens a person who has obstructed sleep apnea. This means that when we wake up at the end of a sleep period, we don't wake up relaxed and we do not have restful sleep. It leads to a large amount of fatigue during the day and also some cognitive issues. 25% of commercial drivers in the United States are estimated to have obstructive sleep apnea. As I said before, it leads to a number of medical issues, including cognitive impairment, high blood pressure, heart attack, and stroke. In a disturbing note, 47% of commercial drivers reported falling asleep at the wheel at some point during their career, in a study done in 2000. Sleep apnea is a huge issue, and if left undiagnosed and untreated, will disqualify a driver. Diabetes. Commercial motor vehicle drivers have a much higher occurrence of diabetes in the general U.S. population, 12 to 16% versus 8% in the general U.S. population. Genetics and lifestyle choices greatly affect diabetes. If you've had folks in your family who have diabetes, you are much more likely to have it. Additionally, diabetes is greatly impacted by obesity and poor diet and a lack of exercise. 3 key issues that affect truck drivers. Insulin-dependent commercial motor vehicle drivers are disqualified under the federal regulations. Once you get to the point where you require insulin, you will be disqualified unless you can get a waiver from the state where your license is issued. It's very difficult to get, and most trucking companies, most insurance carriers shy away from this. Uncontrolled diabetes can have a profound impact, and even moderately controlled diabetes can have a profound impact. It really needs to be controlled effectively. If it's uncontrolled, it can very easily lead to heart disease and stroke, kidney disease, impaired vision, and general fatigue. I can tell you from personal experience, unfortunately, when your diabetes, when you're initially looking to control it or it's uncontrolled, you don't realize how bad you feel until you get it under control. Now we've talked about all the bad news. Let's try to move towards some positive and some solutions that can help your drivers and the company in some simple steps. Obesity. Really, this is the underlying cause of many health-related problems for drivers. It becomes a bigger issue as we age. It gets harder to take the weight off as we get older, and we tend to pack more pounds on. Really, the key to controlling obesity is implementing a lifestyle change To lose weight, we need to be willing to make some fundamental changes in our lives. Included in those are making healthy food choices. One suggestion is to pack for the road. For local drivers, take a lunch box or a lunch bag. For over-the-road drivers, use a portable fridge. Load up at your grocery store on healthy items such as lean meats, fruits, and vegetables, so we avoid going to restaurants and really avoid the truck stops and the buffet tables. If you need to eat at a restaurant or you prefer not to eat out a lot, select restaurants or truck stops with better food choices. Avoid fried and fatty foods. They tend to be staples at the truck stop. Don't go right to the fried chicken and the chicken fried steak. Look to see if they have broiled or grilled fish, fruits and vegetables, and other choices. Again, and also eat more fruits and vegetables. A typical driver eats approximately 1 serving of fruits and vegetables a day. It's recommended by the USDA that the average individual eats 5 servings a day. So most drivers are deficient in this area. And one of the other key things with fruits and vegetables, your healthy vegetables are going to help to burn off the fat and burn off the unhealthy sugars that we're trying to get away from. Another suggestion for drivers is drink water or iced tea instead of soft drinks. Soft drinks tend to, if you drink sugared soft drinks, obviously they have loads of sugar, and all soft drinks, or almost all soft drinks, have large amounts of salt. One of the important things to remember when we talk about making healthy food choices, if it tastes really good, it's probably bad for you. Additionally, foods that are prepared, such as canned soups, again, soft drinks, frozen meals, tend to be very high in sugars and salt. That's how they taste good. Have a regular eating schedule. Plan your meal for drivers. They should be planning their meal times. Try to eat at the same time every day. Avoid snacking between meals, and avoid eating right before you go to sleep. Another way to combat obesity is physical activity. Being active on a regular basis, exercising out on the road. At a recent seminar I attended, the presenter was talking about a driver she studied and how that over-the-road truck driver, when he was taking his 10 hours off, calculated how many times he needed to walk around his truck so that it would equal a mile. And every day he made sure that he walked at least a mile at each truck stop, at each stop he made. Additionally, some companies are now giving out stretch bands, and there's pretty much you can find portable exercise equipment that'll fit in most vehicles at this time. Physical activity is critical. Smoking, one of the biggest problems in trucking today. More than 50% of commercial drivers smoke. It's made worse by the fact that the drivers have isolation and boredom on the road. For folks that I know that are smokers, even when they're trying to quit, if they have a long road trip, it is very hard for them to go without a cigarette. Compare this with only 20% of the U.S. population that smokes. It's a major cause of a number of diseases, including high blood pressure, heart disease, cancer, stroke, and it also creates major complications for diabetics. One doctor told me, having diabetes and smoking is like committing suicide slowly. Additionally, smoking is a very expensive habit. For the pack-a-day smoker, it costs $2,000 to $3,000 a year, and some insurance programs now charge more for smokers than non-smokers, so there's a huge penalty to smoking, and it's important to educate our drivers about this. If you smoke, quit. If you quit and start again, keep trying to quit. It takes persistence, but it's worth it. Additionally, many trucking companies and other organizations are starting to limit smoking around dock areas and even in truck cabs. A number of years ago in Ohio, when they changed some of their laws for smoking in buildings and in company locations, one of the issues was whether truck cabs qualified as a company location. So a number of trucking companies stopped allowing their drivers to smoke in the cabs of their vehicles. It also serves as a distraction. strains and sprains. It's a big problem for truck drivers. Drivers often go from no exertion to major exertion with no preparation. They may be moving or securing freight, unloading a trailer, taking a couple items off, or even loading up. Also, they spend a lot of time, a lot of exertion, sliding tandems on a trailer, locking and unlocking kingpins on connecting the trailer to the tractor, and checking around the truck and or trailer. It can be a lot of bending and looking to look under a truck to make sure it's in good condition, inspecting and thumping tires, hopping up and down off of the truck. It really is important to maintain good condition to avoid these sprains and strains. I would estimate that close to a third of all driver-related injuries come from getting in and out of their vehicles because of the stress it takes on their joints. This is especially true if they are markedly overweight. Another suggestion to avoid work-related injuries, to avoid the strains and sprains specifically, is don't overexert yourself. Drivers need to contact dispatch or maintenance if a part won't move, such as a slider, or if the customer has ridiculous expectations on the driver. This can include telling them you need to unload this trailer right now, or you need to unload it by yourself, and oh yeah, by the way, we don't have a forklift that you can use. Another good way to avoid strains and sprains is to stretch before engaging in vigorous activity. Just like an athlete, drivers need to get warm before they can work hot. When we watch a football game on Sunday, or even watch a batter getting ready to enter the batter's box, we watch them stretch and get ready for the vigorous physical activity they're about to undertake. For truck drivers, the level of activity is often close to what these professional athletes have, and it really is important to stretch before engaging. Diabetes, as we said, it affects 12 to 16% of commercial truck drivers. Some suggestions to help control this horrific disease before you become insulin dependent include consulting your physician regularly. Make sure that they're monitoring your levels and make suggestions for how to avoid becoming insulin dependent. For diabetics, it's also important to monitor glucose levels regularly. Take your take your monitor with you on the road and make sure that you stay within acceptable ranges. Another important part of controlling diabetes is taking the prescribed medications when you're supposed to. Nutrition is critical. Avoid high sugar foods. Though, as I mentioned before, they include most processed foods, candies, and even many fruits. Exercise. It's a huge part of solving the problem. Burn off the sugar before it settles in your fat cells. Protect the feet and lower legs. Diabetics are prone to foot and leg infections. If you're a diabetic, you have less feeling in your extremities and may not even know that you stepped on a nail or some other item that pierces your foot. To compound that problem, infections become much more severe oftentimes in diabetics. What may seem like a minor wound under normal conditions can result in a raging infection if the individual is a diabetic. Sleep apnea and sleep disorders. We talked about obstructed sleep apnea already. First and foremost is maintain a healthy weight. Oftentimes, the easiest way to solve a sleep apnea problem is to get your weight down within a healthy level. Consult with a doctor if there are concerns about apnea. These include a driver or individual who has excessive snoring, who wakes up with unrefreshed sleep, and also the BMI index. There was a lot of concern, there was a lot of confusion last year in 2012 and early 2013 about BMI indexing. Some folks took the DOT to be saying if you had a BMI of over 17, if you had a neck size of over 17.5 or a BMI of over 30, you need to automatically be tested for sleep apnea. That's not the case. But when looked in total, if you look at the neck size, the BMI, and other issues, these can be strong indicators of sleep apnea, and testing has become much cheaper and easier, a lot less intrusive than it used to be, so it really is important to consult with a doctor if there are concerns. Some other issues are avoiding alcohol and other medications to go to sleep. If you need that to go to sleep, you have sleep-related issues. Keep a sleep schedule whenever possible. I know it's a challenge. We know it's a challenge for many truck drivers, but keeping a regular schedule leads to better and more sound sleep. And obviously, try to sleep whenever possible in a quiet and dark room. If you're diagnosed with sleep apnea, you must treat it regularly. Now let's move on to some employer solutions. First, let's talk about the roadblocks. One of the big challenges to any wellness program is the owner-operator issue. When you have owner-operators, it's hard to tell, they don't have benefits from the company, and they are not technically employees of the company, but yet they have to have a valid medical card and fall under your operating authority and your liability. So while it's a big problem, it's important to educate them as to wellness issues. Another challenge is no benefits for drivers. Many organizations, especially during the economic downturn, did away with insurance programs for drivers. Another issue is many drivers aren't willing to enroll in insurance programs. They just don't want to pay the money for it and don't see the benefit of health insurance. Presently, there's a critical driver shortage, and at times we make accommodations for folks that we otherwise may not hire or may not think suitable for the job because we need people to drive our vehicles. Then there are just the stubborn drivers who just don't, even if they have insurance, don't want to change and have issues because it's, wellness programs are seen as being not masculine, or not seen as being not masculine and something that they don't want to take part in. We talk about wellness from the company standpoint. First thing is to educate supervisors and managers that they need to care about their drivers. They should have empathy for the guys out on the road, understand the challenges that their drivers face, and how they can help them and encourage them to be healthier out on the road. It's important to keep track of driver progress on the road. If you sense a problem as a dispatcher or manager or supervisor, you need to act. In one situation I was involved with last year, I was talking with a trucking company where their driver passed away out over the road. The driver, when he left the terminal, he wasn't feeling well, and then he took a sleep break 3 or 4 hours after leaving the terminal when he was going to go about 1,000 miles up the East Coast. One of the things I asked operations management is, why didn't anybody check on him when they saw that he stopped so quickly after going out on the road? Keep track of that progress, and if you see issues or if you see somebody staying someplace for a long time where they shouldn't, do a check call. If you know that somebody's not feeling well and they're out on the road, make sure that they call in regularly. Ask your driver, be concerned about them, and try to, it's especially hard for over-the-road fleets, but try to keep track either via cell phone or with mobile communications devices such as the Qualcomm. Supervisors also need to watch for indications of substance abuse. These can include erratic behavior, violent, emotional outbursts, and the other telltale signs such as bloodshot eyes, not being able to walk a straight line, or other physical maladies. In those situations, you need to let somebody know. Another key thing is to establish internal driver health resources. Where should the driver go when he has questions? Health insurance plans. When selecting an insurance plan, it's important that it be acceptable. When you're selecting a health insurance plan, it needs to be acceptable to drivers. Two key issues are cost, obviously being affordability, and also ease of use. It needs to be user-friendly for most drivers. If there is an insurance plan, make sure the drivers know the benefits. It's amazing how many drivers do not take advantage of what they are already paying for, and employers that do not take the time to educate their drivers on these benefits. It's like money going out the window. Some key parts of most good benefits plans or insurance plans include online health assessments, annual checkups, and pharmaceutical benefits. These are available at little or no cost to the driver, and all too often they don't know about them. On the wellness side, when we talk about specific wellness programs, obviously use and coordinate with health insurance. If you're going to create a wellness program outside of the health insurance program that you have, it needs to be integrated with the insurance program so that it's seamless. Hub has a number of wellness consultants that can, on the benefits side of our organization, that can assist with implementing or creating these programs. When you have a wellness program, it's important to promote it to drivers aggressively. An active marketing campaign and regular communication to drivers is huge. There also needs to be a strong educational component, not just communication, but the why and why this is important and how to go about this. Educating their family members as to the importance of driver wellness is a huge part of this also. Another key component is baseline and follow-up testing. Drivers need to be able to track their progress, how they're improving, where did they start, where are they, and where do we want to get them to. Privacy of health information is critical. We can't, many drivers won't participate if they think that this health information is going to have an impact on their job with the organization. So it needs to remain private and outside of the company. And finally, many organizations that have successfully implemented wellness programs have utilized incentives for participation. These can include financial, such as rewards or reduced insurance costs, and also making it fun, making it a team competition. We talk about occupational medical providers. It's important that you have a relationship with your occupational medical provider. They should know your business. Schedule regular meetings with your occupational clinics. Talk to them at least once or twice a year about changes that are going on from the DOT and or issues that they've seen out in the field. Contact them when you have questions. If you see a long form of a physical or you have a question about something when a driver hands you a prescription, call them. Most fleet organizations don't have doctors or medical professionals on staff, so when in doubt, ask the professionals. And again, asking them for updates on specific issues such as the upcoming changes and recommendations for exams from the DOT and other issues with medical certifications for providers can be very helpful. Your safety department needs to be able to say no to a new hire. When in doubt, even with demands on the fleet, they need to be able to say no when they see somebody that they don't think that's not going to either be able to do the job or really can't drive the truck safely. As we saw in one of the early pictures, the obese individual whose stomach was hitting the steering wheel might not be somebody who can't climb up in a truck safely. Provide information regularly to employees on health issues. The key part of safety management is telling the guys what's going on. Review the DOT long form. There's two trains of thought on this, but when in doubt, review the long form. And last but not least, stay abreast of changes in DOT regulations and recommendations that come out concerning health issues. The DOT, the FMCSA, is at the end of this year is supposed to come out with some recommendations for driver health, and has stated that in the next couple of years, driver wellness is going to become a huge focus of theirs. At Hub Risk Services, we can assist in assessing your wellness program and overall driver safety program. Provide driver and management training on safety, on wellness issues, and help to bring together good vendors to assist with your wellness programs. As to Hub Risk Services, we have, or Hub International, we have over 6,500 employees across North America and are the 10th largest global broker. For Risk Services divisions, we have folks who specialize in safety management, regulatory compliance, wellness, and industrial hygiene. These are all areas that can have a profound impact on your wellness program. We'll now open this forum to questions.
If you have any questions at this time, please press star 1 on your telephone keypad. You will hear a tone acknowledging your request and a prompt to record your name. If you would like to withdraw your question, please press star 2. Again, that is star 1 for any questions at this time, and remember to record your first and your last name. Please hold for your first question.
One question we received over the internet was in regard to when and how these slides and recording would be available. You can access the slides and the recording from our website at www.hubinternational.com. We're on the Risk Services section. Oops, suddenly that went away. On the Risk Services section, you'll see that we have upcoming webinars, including some on slips, trips, and falls and cargo and vehicle theft, but also recording of our previous webinars and slides. A number of these relate to transportation industry, including last week's webinar on Fleet Safety 101. So we encourage you to visit our page at hubinternational.com /business-insurance-risk services. Don't go to that much trouble. Just go ahead on in, visit our website, and search for webinars, and you will find the page. Any questions from the phone lines yet?
We have no audio questions at this time.
Okay. Another common question that we have in previous webinars related to this. Steve, you mentioned something about how it's harder for drivers because they have issues with wellness programs because it's not manly. What are some of the approaches that trucking companies do to address that issue?
Well, I think first and foremost is they need to understand that that wellness has a profound impact on their ability to drive a vehicle and make a living as a truck driver. That's first. Secondly is educating them as to, really just kind of making it a team-based approach, showing that it's not one or two individuals that, what are some of the whys and the hows. And I think focusing on the reason we all work is that we want to provide for our family and continue to be able to provide for our family. And if we're not able to work and or we're not able to enjoy ourselves, then why are we working? So kind of putting it in a proper context and showing where the real benefit is huge, and it's something we don't do often enough.
Okay, we have another question from the Q&A. Alicia Bachman asks, can you tell me who will be responsible to ensure that the medical examiner is qualified to perform a DOT renewal?
There is a registry that the DOT is putting out where these examiners need to be qualified. They're going to need to be certified by the FMCSA. They're going to have to go through some kind of training and or it's a certification process. If they're not certified starting next year, they won't be able to do medical exams. They'll need to provide you with that certification. And it looks like there will be an online registry. I wouldn't wait for the registry at this moment. I would require the certification. Were there any more questions?
That's all we have for now.
Well, I would like to thank everybody for participating and being on this webinar today. And please feel free to contact Hub Risk Services if you have any additional questions or concerns. Thank you and have a good day.
This concludes today's call. You may now disconnect.